Bismillahirrahmanirrahim. Today we're speaking about Chapter 10 under title Decision and Compliance Support Utilizing the Database. Learning outcome. When you finish this chapter, you will able to describe the uses of the dashboards in the Prime Suite to meet the meaningful usage standards. Explain how data and information are used in the decision support. Set up systems report using Prime Suites. Set up usage report using Prime Suites also. Explain uses of for an index. Describe uses for a registry. Explain how data gathered in a Prime Suite is used in the credentialing process. Key terms for this chapter, so we're speaking about benchmarking, we're speaking about Central of Medicines and Medicaid services, certified electronic health record technology, core objectives or credentialing, customs reports, dashboards, details reports, drug formality, healthcare integrity, and protections data bank in index and in networks. Next slide, continue about the key term menu objectives, national practitioners data bank, physicians quality reporting initiatives, and the registry, and the summary report, and the variable. Uses is one of the objectives for Prime Suisse dashboards. So we are seeing many types of informations regarding the administrative informations and medical informations. All these information we can use it to increasing the efficiency of the Prime Suisse software and checking every procedure done for checking every procedures make for the patients. Next slide, we continue about using Prime Suisse dashboard to meet the meaningful user standards. 2011's Medicare core objectives. Number 9, recording of smoking status. 10, clinical decision support functionally. 11, reporting clinical quality measures. 12, ability to exchange key clinical information among providers, ability to provide electronic copy of the health information. Number 14, ability to provide clinical summaries. Number 15, we are speaking about the privacy and security providers. So from these two slides, we can see many types of informations in the Prime Suite dashboard. As we mentioned before, Prime Suite is a software to manage the health informations in hospitals. All these informations or technique, we use it to improving the quality of the information in medical record. And the same time, we can increasing the quality of output of the medical procedures. So that will affect in the patient satisfaction in the end. Next. We will continue about using Prime Suisse dashboard to meeting meaningful user standards. We speak about menu objectives, additional functions to allow greater the use of electronic health record functionally, examples, running statistical report. Also, Prime Suisse dashboard offering this options, that's option for statistical report, options for registers, option for list of the patients, patient index, can checking of for drug interaction. This is very important functions for the software uses in the electronic prescribings to increasing the uses of the drugs, so that stopping the interactions between the drugs, providing patients with educational materials about their illness. Also, we can use the software as education for the patients if the patients need education about his situation or about his illness. This education regarding the medication, regarding the exercise, regarding the food, etc. For all these points regarding the general informations, clinical informations, because we're speaking about the core objective for medical documentations. We're speaking about CPOE is a system used by physicians to to enter the orders and tracking the orders. We're speaking about electronically generated transmits prescriptions. مواضيع التعامل مع ملء وإرسال الوصفات الطبية إلكترونيا. نتكلم عن النقطة الثالثة electronic health record must show evidence that demographic collect include. الآن الإيفيدنس بيتكلم عنه الآن وثيقة رسمية أو مرجع رسمي يبين الجندر، يبين اللانجوج، يبين الريس، يبين الethnicity، بيبين الداتا of the birth. Number 4 يتكلم عن vital signs must be recorded from the first visit and include the highest, the weights, the blood pressures, the blood mass index, a growth chart including body mass index for the children from 2 years to 20 years, the smoking status for the patients 13 years of age and older must be recorded as structured data. الأطفال اللي عمرهم 13 سنة وأكثر لازم ينكتب عنهم وضعهم في التدخين ونعملها updating كمية التدخين اللي بيدخنوها every day. Use of clinical decision support as a systems to arrive to correct support and correct decision. Provide patients ability to view online. الآن البرايم سويس أو electronic health record systems ممكن يعطي خدمة للبيشنس إنه يتواصل مباشرة أونلاين عن طريق السوفت وير مع الهيلث كير بروفايدرز. provide clinical summaries for patients and each of visit. كل visit يزورها المريض لازم يكون في عندي summary للفيزيت هاي يتم متابعتها في next in another next visits. Protect electronic health information created or maintained by a certified electronic health record technology through implementations and appropriate clinical capabilities. قضية informations وال great informations in electronic health record and appropriate updating and implementations for these data. Incorporate clinical lab tests results into the certified. Number 10. Incorporate clinical lab test results into certified electronic health record technology as structured data. Generate. Number 11. Generate a list of patients by conditions to use for quality improvement, reductions of difference, research, or to contact. We can continue about the same topic. Number 12, using clinical relevant information to identify patients who should receive reminder for preventive or follow-up care. الآن عندي reminder في السوفت وير نستخدم فيه مرة في البرايم سويت الشكل العلم بحيث إنه يكون reminders للأشخاص اللي بيشتغلوا فيه. هذا reminders ممكن يكون للبيشنس إذا بيستخدم السجل الطبي الإلكتروني بشكل مباشر أو يكون للهيلث كير بروفايدرز بحيث إنه يعمل reminders about the preventive technique, reminder for the food, reminder for drug, for reminder for the care, etc. Use certified electronic health technology to identify patient-specific education resources and provide these resources to the patients if appropriate. ممكن أن أستخدم electronic health record technology to provide education for the patients and determine the source of the educations and send to the patient to use it in the educational level. Number 14, eligible professionals who receive patients from another settings of care or providers of cares are believe an encounter is relevant should be perform medication satisfactions. Eligible professionals who receive patients from another settings of care or provide of care or believe an encounter is relevant should be perform medication satisfaction. الآن قضية الساتسفاكشن والبيشنت ساتسفاكشن قضية مهمة جدا، فبالتالي إذا كان المريض محول من قسم لقسم أو مستشفى لمستشفى لازم دائما وأبدا الهيلث كير بروفايدرز thinking very well about the medications satisfaction which related to the patient satisfaction. Number 15, eligible professionals who transitions or refer their patients to another settings provider should provide a summary of care record. الآن إذا أنا بنقل المريض من قسم لقسم أو مستشفى لمستشفى لازم دائما وأبدا عندي summary كامل عن حالة المريض يحتوي المعلومات الإدارية والمعلومات الطبية بحيث إنه new providers can understanding the situation of the patients and we can send a copy of the medical record. Number 16, capability to submit electronic data to the immunizations registers or information system and actual submissions. And also we can offering a service to submit electronic data regarding the immunization register or information system by the system, from system to system or from department to department. If we have internet networks between different hospitals. Use secure electronic message to communicate with the patients on relevant health information. كمان نفس الوقت عندي البرايفسي privacy or the private messaging technique which allow the health care provider to contact the patients by privacy technique or private technique, so that only the provider and the patients can know the information which is sent by messages, private messages. Number two, speaking about data and information used in the decision support. Clinical decision support is a clinical system, applications, or a process that helps health professionals make clinical decisions to enhance patients' care. So the clinical decision support, the target for objective for clinical decision support to enhance the patient care. That means this system can help us to find good decisions about the patient's situations. Use improves patient safety, decrease duplications, reducing unnecessary testing, and can reduce the cost of healthcare. This is also one of the benefits of a clinical decision support. Number two, improves patients' outcomes and efficiency. Improves patients' outcome and efficiency. Next slide, the same topic, data and information used in the decision support. Examples, reminder and alert, diagnostic and therapeutic guidance, links to expert resources, Mayo Clinic and clinical trials, for examples, result for best practice. This is examples how I can use the information or data which I have with another institution can help me more efficiency. Also with reminder and alert alarms, or linking with the expert resources. Some providers may not be accepting of special technology. Some providers may not be accepting of special technology. الآن هاي قضية صراحة من الباريرز اللي ممكن تكون تحد من تطور المستشفيات إنه ما يكون updating about the health information technology as general, so that we cannot example linking with expert resources, we cannot using a reminder and alert system, we cannot using therapeutic guidelines, etc. So that all the hospital must updating and using the new technology in health information, especially in electronic medical record. Next slide, using of report writers for system reports, use of report writers for system reports. Standards report are used by most medical practices. Standard report are system built. Administrative as well as clinical standards report are available, so that any medical record or any medical practice must report it very well, so that the systems can give me the options to create good report that help the healthcare providers to improving the service. All these reported or standards of reporting or creating reports can help the healthcare providers to take the correct decisions and build good medications or treatment plan for the patients. Number three, use of report writers for systems reports. Example of standards reports available in the Prime Suite. Payment analysis can give me analysis for the payments of the patient must to pay. A procedure code analysis, the code and the procedure very clear and anyone can understand it. Provide revenue summary about the case of the patients regarding medical or finance, patients balances, referring providers, Appointment analysis report, summary report versus detailed reports, so that we have compare between two things, the summary report of the patient situations, and we can compare the summary with the details report. The summary must give me the conclusions of the details report. Next slide about traditional report writing. Traditional reports run based on the specific parameters or variables. Traditions reports run based on the specific parameters or variables. Variables, factors that vary from one patient to the next. Example, age, zip code, diagnosis code, procedure code. This is the examples of the variable must give a codes. Use when the standards report do not provide levels of details necessary. Run traditions reports to answer multiple questions from managed care, public health agencies, or accrediting agencies. Number five, we're speaking about uses of indexes. Index is a list used to find all patients that meet certain criteria, generally used to find basic informations. This basic information as master patient index, diagnostic index, procedure index, physician's index. Next slide is speaking about uses of registers. Registry is also listing, but in chronological order based on the when some things occurred. For example, birth registers, cancer registers, trauma registers, product quality research institute registers. Other registers include birth defects, diabetes, implant transplant, and HIV/AIDS registers. National practitioners that data bank require submissions. Healthcare integrity and protections data bank require submissions. This is examples for register uses. A register must become a specialist in the specific area in the health or medical parts or divisions. That's helped me to increasing the quality and make my documentations or registers process more clear and more quality. Number seven, the credentialing process. Credentialing is verification that care providers has proper qualifications to practice medicines. Include in credentials are educations undergrades as well as medical schools, residency dates and institutions, banding settles malpractice cases, a proof of purchase of malpractice insurance, board certificate. This is about a credential process which can use it to improve verifications the care providers. Summary: use of the dashboard in Prime Suite to meet meaningful user standards. How data and information are used in decision support. System reports using Prime Suite. Customs report using Prime Suite. Use for an index. Use for a registry. How data gathered in the Prime Suite is used in the credentialing process.